Our 9 Cares Colorado Shares Drive is going on right now through Sunday, June 15th. And we're working with local food banks, as we always do, to raise money for people who are facing food insecurity.
And we're joined now by 9 News mental health expert, Dr. Sheryl Ziegler, about this issue, a very important issue, and a lot of Coloradans are facing it. So how big of an issue is food insecurity, and how many children are affected right here in Colorado?
Yeah, I think people will be surprised to know that it's about 1 in 8 children struggles or is somehow affected by food insecurity. That's about 130,000 Colorado kids. So what that really means is it's usually, you're not sure. It's a true insecurity. You're not sure. Maybe there's going to be food tonight, maybe there's not. Maybe there's going to be breakfast tomorrow, maybe there's not. So it doesn't necessarily mean that every single day looks like, oh, we don't know where food's coming from. It's an insecurity. It comes and it goes, and it depends on so many factors. And it actually is a huge mental health toll on kids and families.
Let's talk about that. Like, how does that manifest? And actually, I feel like it's so hard just growing up in today's day and age, being a kid, you know, in 2025, let alone thinking, not knowing, right, where your next meal is coming from. How does that show up mentally and emotionally?
Yeah, it does show up mentally, physically, emotionally. So mentally, the biggest driver is usually anxiety, just an anxiety. And I am talking about young children. So meaning just, you know, that feeling of like not knowing. And kids, they thrive off of structure and predictability. So then there's the not knowing, and then they get older or they start noticing that maybe one of their parents is giving up some of their food, that their parent's not eating that much, because that's what families do. They get in a certain amount of food, and parents will usually sacrifice, of course, themselves for their kids. So there's that part. Then physically, they're not fueling their brain consistently. So when they go to school, there's an impact on their attention, their focus, their concentration, their ability to really thrive. And so there's that piece. And then emotionally, they might not want to have kids over. They may want to, you know, kind of keep this a secret. They feel this sense of shame. They walk around with a great burden. And if they are an older sibling, kind of like a parent, the older sibling will then at some point start to get into that mode of, no, I don't need so much. The younger kids need it. So it really has a tremendous impact on how they do in terms of their community, their involvement with friends, how they learn, and really how they function within their family.
That is heartbreaking. I would just have to say, you know, if a child is outside of their home, let's say they're going to summer school or whatnot, and I know a lot of kids, by them going to school, that's how they get their meals.
Yes.
For some kids.
Yes.
Are there any red flags, whether a caretaker can be aware of, a teacher, a coach, a parent?
Yeah, absolutely. I think those are kind of like our frontline people, the teachers, especially throughout the school year and going into summer, all of the people you named. And so, yes, the red flags are, well, you're looking for the child's mood, right? How does their mood seem? How does their energy seem? What is their relationship with food? Are they seeming to be taking, you know, you see everything. Are they taking more food and kind of like stashing it in their backpack? Or some kids will get a meal for lunch and then they'll say they'll eat only a little bit, and then they'll wrap it up though and want to take it home. So there's that piece. And so you really want to look for, is there a change in their pattern of what they know? You also might just be able to tell right away. And so if they are particularly hungry, it might go the other way where they're asking for seconds, they're asking for thirds. And that can be hard as a frontline person, because these kids are growing and there may not be insecurity going on at home. And so if they want to approach it, whether it's with the kid or with the parent, the first thing you want to do is, well, you always want to lead with empathy and compassion. And don't make assumptions, right? It's just an observation. You're just throwing out a curiosity. Hey, I'm just wondering, you know, do you feel like we've got extras? Would you like to take some home with you? Or would you like me to talk to your parent about that? Or maybe you just go to the parent. There's a lot of different ways. There's not one way. But essentially, you want to lead with curiosity and compassion. And you really just want to say, if you can, if there's ways to help out, like, hey, no big deal, help out. Or provide them with resources if you know them.
And I think one way that you can do that now is by 9 Cares Colorado Share. So thank you for that, because I think you just add a little perspective for folks thinking maybe we want to donate this year. Yes, donate. That's just a million reasons too.
There's a huge need.
That's right. Dr. Ziegler, thank you.
Thank you.
Just one more reminder for you guys, our 9 Cares Colorado Shares Drive is going on through Sunday, June 15th. You can scan this QR code right here to our donation page. You can also donate when you're checking out at King Soopers.
Welcome back. June is a month to talk about something that a lot of men might be neglecting, their health. For more on Men's Health Awareness Month, we bring in our parenting expert and licensed clinical psychologist, Dr. Sheryl Ziegler. We want to start just why is it important to talk about men's health? I feel like it's something for a lot of guys they just don't think about or don't talk about.
Yeah, we have to talk about it because they don't talk about it, right? You all don't talk about it. There's so many aspects to it, but if you look at men's mental health, it actually should be sounding some alarms. There are stats that say, men suffer from depression and anxiety, substance use issues, PTSD. And in men, those can look like, it doesn't necessarily look like sadness. Maybe the things that we imagine in our heads. For men, it can look like irritability and anger or withdrawal. And so when we look at the mental health issues that are impacted within men and then what they do about it. I mean, only 1 in 5 men says they have a friend, and out of those, they don't really talk about feelings. Literally, like 27% of men say they'll talk about their feelings or real things with their friends. And so we've got men out there that we know are suffering from mental health issues on the rise, and it's very much connected to your physical health as well.
Well, that's a question I was going to ask you. Like, where is that connectivity? And if you're like looking for one thing, could you see it manifest in the other side?
Yeah, so there's a couple of things. If a man has any of those kinds of issues, the mental health, pretty significant chronic issues, we know that they are more likely to suffer from high blood pressure and heart disease. And they're very, very closely connected. So one of the things that some studies show is that it's not just the quality of life. So men not talking with friends or talking about their feelings or getting help when they need to, it affects the quality of their life, but literally the quantity, the years of their lives. They live shorter lives because we need social connection in order to just thrive. And then if you have a mental health issue, you do need some help. And so men are still, not so willing to talk about these kind of things.
Yeah, after a long week or whatever, I'll say, I'm just gonna go on a hike or take the dog for a walk. Just get out in nature and be by yourself or think about the week and kind of make everything work. And everybody has different ways of connecting with themselves and thinking about it. But what are some practical tips that you can give to maybe a bunch of guys who don't really talk about mental health?
Yeah, well, that's one of them. One of them is to be physical and be outside in nature. That helps for sure. I think the other one is to say, okay, so am I balanced with that? So if you said to me, well, the only thing I do for stress reduction is go do something solitary, then I might say, well, why don't you add something social? And if you don't have friends or someone you're comfortable reaching out to, you can maybe go to old friends, see, if you're comfortable going to them. You can also do that general just check-in with yourself. Like, where in my life am I balanced and where maybe am I off balance? Other things that you can do are truly start talking about this. So that might lead you into a therapy office. It could also lead you, if you are a father, if you are a grandfather, it could break this generational cycle. So when your son or your nephew or your grandchildren see you talking about self-care, mental health, getting treatment, that in and of itself can be a game changer. It's like, okay, if you can talk about this, then I guess it's okay, and therefore I can talk about it. So truly, you have the power to break these generational cycles and the stigma just by simply talking.
That's important.
Yeah, very good point. Good conversation too, Dr. Sheryl Ziegler, as always. Thank you for your time.
Thank you.
As a mother of 2, and they just walked in.
They did, and they're so cute.
Oh, looking so adorable. I worry about this all the time, especially now that we're on summer break, of course, and it's about boredom. Is it actually a good thing, yes or no? I get worried about it.
Yeah, absolutely, because they're, not busy in school and learning and all that stuff. Well, 9 News parenting expert Dr. Sheryl Ziegler joins us this morning to break it down. Good morning. Thank you for being with us.
Good morning. This is a good one. It's about perfect timing. Some people have been out 1 to 2 weeks and they're like, what are we doing?
Right.
I feel like as parents, what we want to do is just fill up all the time. And that can be really bad. So talk about how boredom can actually be really good.
Oh my gosh. I talk about how boredom is so good all the time. So I want everyone to think about boredom as being the pathway to creativity. How else could kids get creative? If we structure all their time, if I even think about Legos, right? If Legos come with a picture and you're supposed to be building the picture, even that's not that creative. That's a different part of the brain. And so we want boredom. We want, and I hate even the term boredom, really. We just want free, unstructured time is the way I would put it. That's not filled in, that allows kids to get so into whatever their body wants to do, whatever mood they're in. Maybe they want to create music. Maybe they want to draw and do some artwork. Maybe they want to stare up at the sky. That's great too. Remember looking at clouds?
Yeah.
And like
Stars.
looking, oh, at night, the stars for sure. And so that's where we daydream. And when you daydream, that's when you create things in your head or you imagine things. So this is lovely. Now, 12 hours of this a day? Too much. Too much, right? But so this morning I woke up, it was so funny, it was like it was reading my brain. I saw Dr. Becky's post this morning and she was talking about boredom blocks. And I was like, ooh, that's good. I'm gonna give her credit for that. But maybe just having boredom blocks, although I wouldn't call that to my kid. I would just say like creativity blocks, right? But in your head, you're like boredom blocks, where there's just unstructured time and you balance it. Maybe it's an hour a day. It depends on the kid. It could go longer, it could go shorter depending on their age. But please don't be scared of this. This is amazing.
Okay.
I see my husband back there, and I know what he's thinking because I am the type A.
You're
parent
more
that-
structured.
I am.
Yeah.
You know, from 9:05 to 9:07, we're going to do whatever.
Yeah.
But he's always saying that time really sparks imagination,
Let it breathe.
creativity.
Yeah. Yes.
And it's so true.
Yeah.
You know, he's so right. That's right.
Josh, you're right.
You're
Do you
right.
hear that?
Yay, Josh.
Wow. I'm sure it's not too much. So, Dr. Ziegler, what if kids are in like camps and traveling and things like that?
Yes, please make sure you really do build in those blocks because that's really important to them. Like I can't emphasize enough how much of their lives are so structured and that's what summer break is supposed to be about, right? Just go figure it out. So the other thing is like when they say to you, I'm bored, right? My response, I've been talking about this for a while, has always been like, oh, that's amazing. That means you have time to do something so cool. And yeah, they're gonna look at you for a second. And I mean, that could be cooking, that could be baking, it could be so many things. And so get excited for your kid and be like, oh, I wonder what you're gonna think of. What are you gonna make, right? And then they'll feel that energy. But if you're just like, that's not my problem. You've already been in camp for 4 hours a day and I still have to work. Like that makes it feel like, oh, then this time is awful.
Yes. Maybe it's time to open that Steve Spangler book of, experiments or something, right?
Yeah.
You.
A good old science, make Play-Doh, make whatever the things are.
When you just said that, like, I'm bored, great, good for you. Literally, Josh goes, because he does that all the time. Yes, like truly. And so I think it's so true about like imagination, creativity. That's when they like think about things and explore new places in the backyard or whatever
explore
it is.
new things and explore things they've never. You could even prompt them. You could even say, what's something that you can try today that you've never done before? What's something you could draw today you've never done before? I wonder if you could write a poem. You can like give them a slight prompt as the parent because I know there's some parent listening right now that's like, nope, that's not going to work with my kid, right? So, okay, prompt them. Or give them little teasers, but they can do it. It's
I
great.
used to take out the camcorder and direct my sister and my cousins, and
Same with
we
my
do
kids.
videos and plays and all sorts of stuff. So use that
look at where
imagination,
you are
baby.
now.
Yeah, look where we are today.
Yes.
Dr. Ziegler, great topic.
Thank
Thanks for coming in.
you.
Thank you.
Maternal mental health is declining. There are fewer moms out there saying they are in excellent physical or mental health, and providers are not entirely sure why this is happening.
Our mental health expert, Dr. Sheryl Ziegler, joins us this afternoon with a closer look. And can you start a little bit by telling us what this new study found? What did they examine and what did they learn?
So this is a JAMA study that did sort of a retrospective. So they were looking over the years from, I think, 2016 to 2023 and looking to see what the differences were. And what they're seeing is that the numbers are going down with moms who are saying, yes, I'm in excellent mental health. And so then I was wondering, okay, well, maybe 2024 and maybe even the beginning of 2025, maybe things have gotten better. Maybe that's like so COVID specific, but in fact, it's not. So it's still continuing to actually go down. Just even in the last year and a half, Science Journal did another study. And so we're really seeing this trending this way. So it can't just be COVID. It's not just a one-off. We're talking probably now a solid decade of research showing this decline.
What do you, when you say not excellent mental health, I don't know that I've ever been able to say I'm in
Right.
excellent mental health as a mom. What does that look
a hard
like?
job.
Seriously. So
Yeah.
what does the declining, are there specifics that you can point to?
Yeah, so they just listed their stressors, right? So it's funny because in 2016, when they started studying this, is when I wrote Mommy Burnout. So I wrote a book about the chronic stress on women because I was seeing that trend myself. And so the things that they're reporting, I mean, there's different groups, that's number one. So the hardest hit group are gonna be single moms. So single moms feel like they don't have enough support, they are really stressed by finances, and so they're lonely too. And the loneliness piece is the thread no matter what the group. And so just feeling, there's a difference between like, do I have people to support me, right? And then do I have connections, people that I can talk to? And that's what, not just among moms, but among many groups in adults and teens, that's what we're seeing is this loneliness and lack of social connection seems to be one of the strongest variables in this.
I can imagine that support systems, like you just mentioned, are a big part of this. Do you have family to help take care of your child? Or do you have family or friends that can help step in if you need to go to work one day or something like that? I can imagine that that has a big impact on mental health when you're looking at which groups are impacted the most.
Absolutely. So when we look at this, people are moving around more. They have job opportunities, educational opportunities. So no longer is the family unit necessarily raising their family right alongside, two sides of extended family.
Right.
And so when something happens, if everything doesn't go just accordingly, or a caregiver calls you out and says, I can't come watch your kids today, you have more and more women who are saying, A, not only I don't have a backup plan, but B, I also don't feel like I can take off because I need this money. And so we look systemically at the systems in place to support mothers and families in general, and that's where we're really lagging behind. Sometimes when we compare ourselves to the whole world, we have some pretty poor, what they consider sort of family systems type support.
How does this affect our children? Because there are moments like in the moment I can feel it. I'm like, I'm not at my best right now. How is this affecting my little girls?
Yes, I know. So that's one of the things that this study also looked at. So one of the findings is, of course, we're worried about these mothers, but this trickles down to your kids. We all know what that feels like. When you're tired, you're in a bad mood, you're stressed out about things, you are more irritable, you are less patient with your kid. And so when we look at the long-term studies, even starting in utero, this isn't a part of this study, but we've talked about it here before, women who are really stressed when they have a baby in utero, we actually see long-term outcomes for those kids. They hold on to those stress hormones. Their brains are rewired a little bit differently. They have higher levels of cortisol. And so it's very interesting. It's not just like, oh, that's too bad, but it actually then it is a generational thing, goes down to their kids and can get passed on. So it's something that really is sort of a public issue. Everybody should care about this issue.
So before we let you go, one final question. What can people do to help? Friends, communities, partners, support systems. What can people who are in a place to help, in a position to help, what can they do to step in and say, hey, let me take this one?
Yeah, interestingly in the study, they actually flat out said, like, when you ask somebody how they're doing, make it meaningful. So not just like, oh, how you doing? Everything going good? We do that and we're sort of keep walking, but really like, how are you really doing? Asking people meaningful ways on how they are doing and then what you can do to be supportive. And so there's different times too when moms are busy and you think, I'm not gonna ask you, you're busy too. But we have to trust each other that maybe I've got a little bit more bandwidth this week. And so I am asking and I mean it. So that's one of the things. And also we've got to look at policies. We've got to look at just how can we support families better in the workplace, and particularly women and single women. Those are our most at-risk groups. And so what can we do in terms of support and also connection, social connection, that they can get those needs met because they're very real.
Very real.
Such an important conversation. Dr. Sheryl Ziegler, thank you.
Thank
as
you.
Always.
Appreciate it.